Hi everyone, Dr. Val here, and I'm coming to you a day late. Sorry about that. It was a busy Sunday. Today I'm going to talk about iron, fatigue, and sleep in women. Lots of things to talk about. This channel is geared for all women, but typically women in midlife and women who are still menstruating every month. If this happens, guess what? You're losing blood. Blood has iron in it, and that's a very common reason why women can have iron deficiency, which is low levels of iron, and even iron deficiency anemia when your hemoglobin and your hematocrit go down. So, who am I? I'm Dr. Val, an integrative sleep medicine physician and women's sleep expert. I also have a background in internal medicine. So, I used to deal with folks who've had anemia issues, whether from GI bleeds in the hospital where we'd have to give them transfusions, or people who have like slow bleeds from, menses or heavy menses, ruling out things like fibroids that can bleed a lot. Those are things definitely to consider. And why are you tired if you have low iron? Well, iron, I like to think of it as like the building block. It plays a role with our hemoglobin and hematocrit, which are part of our red blood cell system, right? Carries our red blood cells with oxygen throughout our whole body. And that's how we feel better, because that's how we get oxygen. And that's sort of like we need to sustain our life with oxygen levels. So it's all connected, honestly, the way our body works. And if we're losing a lot of iron each month, if you're having heavy periods, if you're still having your periods, definitely worth to get checked out. Oftentimes, when you go to visit your PCP or physician for your annual visit, they do the standard CBC, which looks for hemoglobin or hematocrit. But guess what? If you're really, really tired and it's not just in around your period, you could have low iron stores and not be anemic. What? Yeah. So I would say ask for a ferritin level and then the iron binding tests. It's really interesting. We check the ferritin. Ferritin, you can think of like the car, and then inside the people are the iron. So ferritin is the storage protein for iron. It's not necessarily specific for iron, though, meaning it's an acute phase reaction. Acute phase reactant, meaning it can go up with inflammation. So if you're sick, it can go high. If you have cancer, even if you're obese, it can go high. So caution for that. People who have chronic kidney disease, sometimes they could be high too. So it's not helpful if it's necessarily high. If it's low, it's helpful. And typically people who are fatigued, who have low iron, low ferritin levels, I should say, less than 50 need to have iron replacement. If you do suspect you have iron deficiency and your ferritin level is high, the other blood test that you can do is the TSAT, which is the transferrin saturation. And it's a marker of the iron availability. So you can get that. And if that's less than 20%, it's considered a good tool for those of you who have congestive heart failure, chronic kidney disease, or even inflammatory bowel disease. So we talked about reasons for your iron to be low. Testing for it. Well, always find the source of the bleed, right? Do you have a colon polyp? Could you have colon cancer? More upstream, could you have an issue with your stomach, an ulcer that's causing bleeding? Sometimes hemorrhoids can cause this. This is in addition to the women's stuff that we can get on a regular basis. Another thing to consider is your diet. Are you not eating good sources of iron? Or did you ever have a surgery where maybe your iron isn't getting adequately absorbed? Or could you have a underlying absorption issue? Sometimes people who have bowel disease like celiacs or it's been a while since I looked and thought about all these internal medicine things, but there are certain conditions that can affect your absorption of iron. Pernicious anemia is one of those things to consider. Yeah, so diet, absorption issues, and then losing blood, right? And like I said, you don't have to be anemic to have a low iron. Anemia just means low hemoglobin or hematocrit. If it's really, really low, if it's an active bleed, then we give you actual blood. But if it's more of a slow bleed, then we find the cause, fix that, and then replete the iron stores, meaning give you iron supplementation. And that's sort of where the rub is. Sometimes you take these iron supplements and they make you feel awful. I had some anemia after I gave birth to my daughter. I was taking iron supplements, and guess what? They make you super constipated. There are some brands that are not as constipating. Those have mixtures of like plant cellulose in it. One of the brands, not sponsored, I like to recommend is the raw iron from Guardian of Life, less likely to cause constipation. Eating iron from food sources, green leafy vegetables, molasses, that certainly can help. If you can get it from plant sources, probably a lot better than having to take a pill. But with that said, I have some people who take iron supplements on a regular basis. They eat a lot of iron rich foods and still have low iron. And what do we do for that? We found out that no active bleeding sources, maybe not having issues with their period. You can actually see if your insurance will cover IV iron. Put iron directly into your veins, and lo and behold, that can make you feel a lot better. I've had patients who actually have low iron, and if you watch the restless leg syndrome video, low iron stores in the brain is associated with restless legs, which is a condition where your legs feel restless before you fall asleep. And sometimes they can keep you falling asleep. So you have to wiggle them, get up and walk around the room. I've had people who have this, they pace for hours. Number one thing, always check their ferritin and then the other iron stores to make sure those are okay. And if not, give them some iron. There's not a good consensus agreement of how long we have to be on iron supplements before we can do IV iron. I typically say maybe somewhere between 3 to 6 months. But also I'm not a GI doctor, so definitely want to make sure that you're absorbing iron and not losing it too fast. Like I said, though, people have felt better with IV iron, and it's certainly not for everybody, right? Not everybody wants to sit and have IV iron going through your veins, but it's just something to consider. And if that's really impacting your legs, your sleep quality, right? The restless legs is before you fall asleep, and then you can have the nighttime symptoms when you actually are asleep called periodic limb movement. That's also associated with low iron stores. That condition, restless leg syndrome, periodic limb movement disorder, is also, there's a genetic component. So if you do have a family history, make sure that's checked out. There are medications beyond iron that can help, things like gabapentin, some of the dopaminergic medications that we used to recommend may have a lot of side effects, things like ropinirole, or ropinirole is known as Requip, or pramipexole known as Mirapex. They've sort of fallen out of favor. That depending on how bad the symptoms are, they may be, sort of the only thing that are helpful for you. So that's a little bit aside from the iron conversation. I would say if you are really, really tired and you are having heavy periods, talk to your doctor about it. Make sure that A, you're absorbing iron if you're taking it. B, we solve any loss of blood, whether it be fibroids or GI sources. Those are the two main cause. Make sure you're getting enough iron. And then if you still are doing that and it's been somewhere between 3 to 6 months and your levels aren't budging, that ferritin or even the percent saturation of transferrin, then consider, ask about getting an IV iron infusion. And sometimes PCPs don't know about this or aren't too familiar. Honestly, I don't order it directly. Typically, I send patients over to the hematologist, and they are quite more, hematologists are blood doctors. They're more familiar with it. Oftentimes, they're also cancer doctors, and so they know about how to order this and make sure you rule out any underlying blood conditions that can also lead to low iron. I hope you found this video helpful, a little bit different from what we talk about typically about sleep apnea and snoring and daytime sleepiness, but there are other factors that can play a role in your sleepiness besides an underlying sleep condition. Where actually having low iron stores can cause sleep conditions, but also if you don't have a sleep condition like restless leg or periodic limb movement, and maybe you don't eat a lot of foods with iron in it, take some iron. But always, even though I'm a medical sleep doctor, I'm not your doctor, get the blood work done. Make sure that what you're treating is intentional. Sometimes people come in to me and they're on so many different supplements and vitamins, and they're asking me if this one's causing a side effect, making them feel sleepy or making them have insomnia, or maybe if their kid needs to be on this, that, the other. And I was like, well, let's find out, right? Is there a deficiency? Do we need to do the blood work? And what blood work do we do? And then can we treat that appropriately? because honestly, a lot of the supplements are super expensive. And if it's not indicated, do you really need it? So I like to practice as much as possible personalized medicine and provide you folks with all the information you need to feel well. Our mission here at Sleepforia is to help women overcome exhaustion and live a fulfilled life through better sleep health. And if you like this video, please share it with your friends and join our newsletter if you haven't yet. And I'll see you in the next video. Until next time, sleep well, ladies. Bye-bye.